Hello there, welcome to another very interesting edition of Health Matters, reaching you live on NTA Channel 12 with you, your dependable station. On Health Matters, we experience several health issues concerning you. Remember, when you're healthy, you're wealthy. And so I'm here today to talk about some very interesting topic that you can't afford to miss. I remain your host, Tumo Pasi Edith. Welcome to the program. And with me today, we have Nurse Zainab Babalula. Zainab, welcome to the program.
Thank you so much.
Okay, so you'll be wondering why Nurse Zainab is in the studio. She's here to talk about maternal health. What do you know about maternal health? So many things. And so over to Nurse Zainab. Zainab?
Okay.
Tell us a little more about maternal health.
Okay, so when it comes to maternal health care, we are talking about optimal health care for women during pregnancy, during childbirth, and after delivery. So looking at a recent research by UNICEF, it is said that every 7 minutes, Nigeria loses a pregnant woman to death. And when we look at it, we see reasons such as lack of access to quality antenatal care services. We see reasons such as lack of access to emergency maternal health care services. So when these things are in place for women, we are trying to ensure that we have optimal health care for women during pregnancy, during childbirth, and even weeks after delivery.
Okay, the statistics you gave us there is very, very alarming. And
Yes.
what do you think would have been the cost of all of this?
Okay, so when we looked deeply into reasons why we have high maternal death in Nigeria, the very first reason is because despite antenatal care being around many hospitals today, it is sad to know that some women can still not afford antenatal care services. And when they afford antenatal care services and they come to the hospital, many are unable to afford antenatal care routine medications that they are supposed to take during pregnancies. Folic acid, calcium, they do not have the capacity to even buy these medications during pregnancy. And we also looked into the issues of lack of access to emergency maternal health care services. So a woman in a primary health care center, if she has a form of emergency, let's say in the middle of the night during delivery, it is sad to learn that primary health care centers do not have emergency buses, ambulances available to transport women like this, maybe suffering from bleeding after delivery. Some women bleed after delivery, postpartum hemorrhage. It's so sad that the primary health care center does not have the emergency services necessary to transport women to higher hospitals that provide higher services so that this woman can get appropriate care. So looking in summary, we are talking about lack of affordability for antenatal care services, lack of affordability for antenatal care medications. We are looking at lack of emergency maternal health care services being available. And also another major factor is most of these pregnant women, they only have access to they can only afford traditional birth attendants, and they are not skilled enough to provide the services that these women truly need.
Okay, that's very true. When we will get there very soon. In the course of this program, we'll be looking at the role of the traditional birth attendant in enhancing maternal health, because they have a critical role to play in this business. So what are those key areas? When you're talking about maternal health, what are those key areas that you think women must look into? Okay,
the very first is antenatal care. We cannot sideline the importance of antenatal care, because this is where we get to catch the dangers of an abnormal pregnancy. This is where we get to catch them. So when we tell women that as soon as you discover that you are pregnant during your first trimester, ensure that you report at the hospital, because it is during the first trimester of pregnancy that is when the development of the baby begins. So we say the very first important factor is ensuring regular antenatal care services. So when we look at antenatal care, we say for normal pregnancies, a woman should at least have 7 to 9 contacts with us for a normal pregnancy during their 9 months. That is at least for a normal minimum. So it is very, very important. Then another important factor is when you come for antenatal care and we have given you the medications, routine medications, because we give them 1 month before their next visit. Okay. We realize that most women, they don't use them.
Take it.
Calcium, folic acid, all of these medications, they don't take them. So it is important that when you come for antenatal care and you are given the medications to go home with, ensure that you use them appropriately.
Okay, so basically looking at the antenatal care services and ensuring that you take your medications. Okay, beyond the antenatal care, you have major issues, maternal health issues like bleeding, high BP. Could you throw more light into some of these issues?
So when we look at hypertension in pregnancy, the medical term for it is preeclampsia. So when we talk about preeclampsia, it is a woman coming up with high blood pressure after 20 weeks of pregnancy.
Okay.
So as soon as you start noticing that a woman has high blood pressure at 20 weeks of pregnancy, then we already note that that is preeclampsia coming to play. And what is the reason for this? It usually occurs during the first trimester.
Okay.
So, and during the first trimester, there is a particular artery in the uterus. We call it the spiral artery. Normally, it is a very tiny artery. It supplies the non-pregnant uterus. Okay. So, as tiny as it is, the uterus, non-pregnant uterus, is fine with whatever it is that the spiral artery is supplying.
Right.
But when pregnancy comes to play and the baby is there, there is a need for much extra blood supply to the placenta. So what happens? There is a particular we call it the trophoblast. It travels into the uterine wall and it tries as much as possible to remodel that spiral artery such that it becomes much more broadened. Initially it is narrower, supplying just the uterus.
Yeah.
But now that there is pregnancy, we are trying to make it more widened. We notice that in women that comes up with preeclampsia cases, this physiology is tampered with. The spiral artery is not widening as much as it is supposed to. And the baby needs blood. The placenta needs as much blood as it is supposed to get. So when that is not happening, what happens? The placenta begins to struggle. It's not getting as much blood supply as it's supposed to. And it releases some substances into the mother's body. So it damages the entire blood vessels of the mother's system. So she then comes up with hypertension in pregnancy. And the particular part of the blood vessel that is affected here is the endothelium. And endothelium, it is responsible for the widening and constriction of the blood vessels. Okay. So when the endothelium of the mother's blood vessels is damaged, there is no control. The blood vessels begins to constrict, and when they constrict, what happens? The mother comes out with hypertension, and the vital body organs that are supposed to get the heart, the kidney, that are supposed to get adequate blood supply, they begin to get affected. And that is included because we say preeclampsia can progress to eclampsia. And when it progresses to eclampsia, it means enough blood is not getting to the brain. Or we have cases like cerebral edema where water is escaping from the blood vessels into areas of the brain, and then we have cases like eclampsia coming in. So we are saying before it gets to eclampsia, let's curb it at the level of preeclampsia. So as a woman, what are the things that you should look out to? You are feeling severe headache that even though you take paracetamol, you are not getting relieved. You notice swellings, puffiness in your face, in your eyes, your extremities, your leg, your hands. So you know that you have to report to the hospital.
Okay, then still talking about this issue, because I think it's very serious now. What happens to the women in the rural area? Some of our, of course, most of our primary health care centers may not really have those facilities to take care of serious issues. You understand? So what happens? What are the ways they can maybe first of all prevent? Let's look at prevention first. What are the ways they can prevent this?
Okay. The very first thing I can say is even at the primary health care center level, we have antenatal care services available. So let them register for antenatal care services, and let them also seek the benefit of health insurance. That is for women that cannot afford to pay for antenatal care services. So when they get the benefit of health insurance, they are able to come regularly for antenatal and access the medications that they need.
Okay, so that means the health insurance covers everybody.
It covers all pregnant women.
Okay, it's absolutely free.
Absolutely,
or they have to
free.
make some payments.
So we have there are two levels to it. So we have the BHCPF level, where you when you register the BHCPF level, it's completely free.
Okay.
And you are being appointed to a primary health care center.
Okay.
And then you can also pay 18,000 naira. I'm talking about the Akwa Ibom State Health Insurance.
Yeah.
So when you pay 18,000 naira, then it covers you for a whole year.
Okay.
And then you get to access any healthcare facility that you want.
Okay, that's good. And then beyond because I know your focus is on pre-eclampsia. Okay,
yes.
But beyond that, we also have issues like prolonged labor, gestational diabetes. Could you just throw more light on some of this?
Okay, so when we talk about gestational diabetes, chronic hypertension, so we are talking about the optimal health of a woman. So when we say pregnancy, it doesn't just begin at the point of being pregnant. So it begins right before it. So when we advocate, we try as much as possible, when you are a woman, keep your weight within the normal range, because we used to say when you are obese, you are susceptible to as much medical conditions as possible. Hypertension, diabetes. So keep your weight optimal and try as much as possible to hit things that are going to be beneficial to you. So once you put all of these things in place, and if you have any medical condition and you are pregnant, it's best that you discuss with your healthcare provider so that they would know how to properly manage it and it does not interfere with the outcome of the pregnancy.
Okay, I also have a particular concern for the women. I always have this concern for the women at the rural areas, because, well, in urban areas we have most of the facilities. So in the case of these women at the rural areas, that most times they work with the traditional birth attendants.
Yes.
How effective? Don't you think that this is also bringing more problem to the health sector?
Yes, I think it brings more problem, more harm than good, because we've seen cases where a woman would even defile antenatal care and say she wants to go to a traditional birth attendant. We've seen cases where we ask a woman to do a CS, and she would say no, she does not want a CS, and that a traditional birth attendants can handle it better. So I think at the level of the community, we need to better educate these women. Let them understand the consequences of the decisions they are making. So when they better understand that this is what is at stake, and if you make this decision, this is the consequence that might arise from it. That is one. Then another thing is, I think we need to collaborate more with the traditional birth attendants. They need to be better trained and educated. So although we do not rely on their practices, they may not be the very best, but they are the closest to the community.
Yeah.
So we need to collaborate with them. And if the government can put proper training in place for them to understand the risk factors, the risk of pregnancies, and how to ensure that there is referral between the traditional birth attendant and the hospitals within the community. So I think that would really go a long way. Okay,
now Zainab, luckily you are a nurse, and we are still talking about the women and accessing antenatal care, as well as the role of the traditional birth attendant. Now, you see that a lot of women who do not want to go to the hospital have their reservations, not because there is no money, but because the traditional birth attendants happen to be more caring than the nurses in the hospital. Have you heard of stories like that?
Yes, yes.
So some women are just prone to, okay, with these women give them more attention, they pamper them, you know, because pregnancy definitely, some people come down with different moods.
Yeah.
So don't you think that our nurses too are not doing enough?
Okay, I would say when it comes to our healthcare facilities, the problem is they are mostly overworked. So you would go to an healthcare facility. I've been in situations like this before, especially when I work in primary healthcare center. A nurse having to like tend to 3 or 4 deliveries all at once. So when you have a nurse tending to 3 or 4 deliveries at once, you are not going to get the best out of that. So they are working under really stressful conditions. So I would say we try as much as we can as nurses, but if we can make better working conditions available for nurses, then it would help us, deliver better services to the patients.
Thank you so much, Zainab. I didn't even expect anything less because it's your profession, so you have to defend your colleagues.
Yes.
But I understand because, sincerely speaking, most of our nurses are overstressed. You go and then you see them working under so much pressure. But notwithstanding, we have to save lives.
Yes.
So that comes first. Despite the discomfort, despite the shortage of manpower in the hospital. We'll be right back after this break. Don't stray away. And welcome back. Good to know you are still there. If you're just joining us, the program is Health Matters, and we have today in the studios Nurse Zainab Babalula. The topic and our focus for today is maternal health. How well do you know about maternal health? Don't touch that dial, just stay. So Zainab, now let's go to your primary focus now, talking about pre-eclampsia. You said you're carrying out an outreach and advocacy.
Yes.
So tell us a little more about this advocacy.
Okay, so this advocacy is just to help women understand the signs and symptoms they need to look out for. Because when we see health complications arise, it is usually as a result of overlooking early signs and symptoms. So we want women to be better educated on early signs and symptoms of pre-eclampsia, so that they know how to put preparations in place. So the outreach is going to be holding at the primary healthcare center opposite the Federal Secretariat. We are going to be having free BP checks, urine checks, and we are also going to be distributing free routine antenatal medications to these women. So, and then the personnel from the Akwa Ibom State Health Insurance, they will be on grant to register women who are not previously insured under the service, so that poverty is not a reason why a pregnant woman's life should be gambled with.
Yeah. Okay, so how many days would you carry out?
It's just a day.
Just a day. What day? Tell us the date.
So
the time.
It's going to be on Monday, next week Monday. That is the 6th of July, 2026.
Okay. What time?
10 a.m.
Okay, from 10 a.m.
Yes.
And it will last till?
It will last till 2 p.m. in the afternoon.
Okay. Okay, so tell us what are we expecting beyond just checking? What happens if you find out somebody that is already predisposed to preeclampsia?
So we have referral forms available, so that we write referrals to a higher facility, so that the women can continue to receive better care from there. So our main goal is to catch whoever it is that has this disease condition early.
Okay. And then, what the first thing that struck me was what inspired you? What would have motivated you into going into this advocacy?
Well, I've been in the practice, and I've seen women go through so much as a result of mismanagement, as a result of ignorance. So, and these are things that could have been prevented. And we see it in the news every day. We say every 7 minutes a woman lost her life. So, meaning that before we actually finish this program, it has
like
a total number of women that have actually lost their life to cases that are actually very preventable. So this is the reason why I try as much as possible to advocate for better maternal health care practices.
Okay, so what are the consequences if you don't do what you're supposed to do, the needful, if you don't try to access health care on time? What are those consequences?
The consequence is maternal death, in most cases maternal death, and child, we have children who are being born to disabilities,
Okay.
So that is also one major problem, because we used to call something the golden hour when a child is born. So there are times that the child will not cry immediately as soon as the child is born, and if there is no access to adequate equipment around to bring back this child to optimal health, it could lead to damages in the brain. So we are saying that we want to ensure that there's adequate access for both the mother and the baby. So at the end of the day, everybody is fine.
Okay, so Naz, you've been in the system for some time now. Would you say that the government is doing enough to improve maternal health?
Well, the government is doing what they can do, but I think they can do better. Yes. So when we talk, especially in the aspect of emergency response to maternal health care services, so in our private health care centers, let's have adequate ambulance services available, so that if there is a need for a woman to be transported in a rural area to a well-functioning hospital in the husband society, it's not going to be much of a hassle. So.
Okay, Nozena, we have a lot to talk about in terms of maternal health. I still had postpartum depression, but let me find out, how do you think families can also support the women in this direction?
So I think one important aspect is as regards stigma to CS, cesarean section.
Okay.
We've had issues where we'll tell a woman that, oh, you are facing issues with labor here, and we need to take you to the theater for emergency cesarean section, and we'll have the families disagree on behalf of the woman that no, we don't want her to do cesarean section. And so whenever whatever care is demanded for a woman at the point of delivery, the family should be supportive, because at that particular point in time, her life is the most important. So they should be supportive of her, and they should ensure that they are around when after delivery, and they are able to cater to the care of both the mother and the child.
Thank you so very much, Zainab Babalola. But before I let you go, you talked about the advocacy which is built for Monday. Could you just recap? Tell us the date, the time, the venue, so that the viewer out there can benefit.
So the advocacy is happening on the 6th of July 2026 at the Primary Healthcare Center opposite the Federal Secretariat. So we are going to be there to give free medical checks to pregnant women, and also give free routine medications to them. We'll also have personnel from the Akwa Ibom State Health Insurance available to insure women who are not previously under the Akwa Ibom State Health Insurance scheme. So it will be so lovely to have you there.
Thank you so very much. So you don't have any excuse not to benefit. If you know somebody that knows somebody that knows another person that needs maternal health care, you need their attention, just key into this opportunity. It's absolutely free. I'm not going to pay anything. The date is Monday, July 6th, and like you heard, there'll also be personnel, they will give you referral forms if you really need to see a doctor and other things. You also have some freebies.
Yes.
Because I know as Nigerians, we love freebies.
Yes, yes.
Okay, so thank you so very much for staying tuned. It's been nice being with Zainab on the program. Zainab, thank you so much for coming.
Thank you for having me.
Okay, let's do it again next time. And so, thank you for watching. It was Health Matters. My name is Umo Basirit. Bye.